Hi, my name is Crystal and I'm a nurse working in Manitowoc County. I would like to discuss with you tonight managing pain during an opioid epidemic. I do want to discuss that the opioid epidemic is a nationwide problem, but my focus is going to be on the residents of Manitowoc County. 20 years ago, Wisconsin saw a rise in prescription pain medication use and abuse with opioid pain medications. Opioid pain medications are narcotic pain medications such as oxycodone, hydrocodone, Percocet, Vicodin are brand names of those medications, to name the more common opioid pain medications. And then we did see a rise in heroin use, and over the last decade, we saw a surge of synthetic opioid abuse of medications such as fentanyl. I do want to talk a little bit about some of the statistics in Wisconsin between 2014 and 2018. So over the last 5 years, the average number of people dying from opioid overdose or death, that rate is 12.1 per 100,000 people. And that is in Manitowoc County alone, totaling 49 people in the last 5 years. And those age ranges average between 18 and 64. You ask, how does this affect the residents of Manitowoc County and why should I be concerned? Well, first off, I would like to more so just educate you on pain management and how we can do that safely and without maybe even needing a pain medication, we can maybe manage our pain, without it successfully. But there are times where pain medications are necessary, and that is why they're prescribed, and that's what they are there for. There are so many elderly people that I come across who just have a fear of taking pain medication who have had major surgery. In those instances, I do tell them that that's why we prescribe pain medication, because it's meant to be temporary during those most acute periods after a surgery or a painful procedure. So typically we would like to see somebody taking pain medication for 2 weeks or less, as opioid dependence can occur in only 5 days. And when pain medication is prescribed as needed, some people look at the directions and, I can take 1 tablet every 6 hours. And then it says as needed for pain. Well, they miss the as needed part, and they end up taking that medication every 6 hours and not weaning off the medication appropriately or stopping it when their pain is controlled. So that's where things can come into play, where people just need more education on how to safely take this medication. I also want to talk about the fact of 1 in every 6 adults were prescribed an opioid pain medication prescription in 2018, which is a staggering amount if you think about it. And when opioid dependence happens, this can lead to illnesses such as infection, opioid-induced constipation. It can lead to memory loss, accidents, increased pain sensitivity, meaning somebody who is taking a pain medication, either abusing it or just being prescribed a long-term opioid pain medication, their sensitivity to pain intensifies. Their nerves are very sensitive, and they don't tolerate pain as well as a normal person would tolerate pain. It can also lead to accidents, overdose, and death. So that's why prevention and education is key when we talk about opioid pain medications. The illnesses and infections that can occur with people who are abusing opioid medications or illegal drugs, we can spread disease such as hepatitis. Hepatitis C and hepatitis B are the most common hepatitis forms that are transmitted by blood, and they can be transmitted by sharing needles or sexual intercourse. And of course, I also want to mention HIV because that is a communicable disease that we're concerned about as well, and why we need to educate our community. The Substance Abuse Prevention Coalition, the prevention efforts in Manitowoc County basically use best practice to ensure that we can prevent substance abuse and misuse, and we can empower our youth and our adults to make healthy choices. We also want to target our youth, and the goal is to really prevent them from ever trying a drug or ever misusing a medication. I do want to also talk about some of the CDC guidelines and the recommendations that they have, that the federal government is really enforcing when it comes to prescribing, and really another effort to try to get a better handle on the opioid epidemic. So basically, there's a safe opioid prescription or prescribing protocol called SOPP that physicians who prescribe opioid pain medications need to follow. It talks about medications and how we measure the opioid medications, and the strength is a morphine milliequivalent. And if a patient is taking equal to or greater than 100 morphine milliequivalents in a day, the protocol set up by the government is that the patients receive opioid safety education, how to take their medication safely and ensuring that they understand, and then also prescribing a medication called Narcan, or naloxone is the generic name, which is an antidote to narcotics. So if there is accidental overdose or respiratory depression, that can be treated immediately and reverse the effects of the opioid that the person has in their system. So that is a big deal and very important. The CDC also has recommendations for patients who are opioid naive, which means that if a patient has never had a prescription for that particular medication before, and it is greater than 50 morphine milliequivalents, they will call the prescribing provider's office and request that that medication either be decreased to only allow that person to take so many tablets in a day, or dispensing a smaller quantity of the medication to be within that parameter, which is something that has been extremely helpful because it's just limiting the amount of medication that a person has available. So these efforts for pain management during an opioid epidemic really is primary prevention by way of educating our community and keeping everybody informed as of the dangers of these medications, what can happen if we don't use these medications properly. And our prevention efforts basically include community awareness, education, and engagement. We want our community to be involved and engaged, because when this happens, we see the use of these opioid pain medication or addiction or heroin use or fentanyl use. We do see a decrease based on these prevention efforts. And quite the contrary, when these prevention efforts decrease and they fall by the wayside, we see a increase in use and abuse of these type of medications and drugs. So I do want you just to get a pen and a piece of paper and just jot down a few things that you think would be good ways to help manage pain without the use of pain medication. And then in just a few minutes, we'll go over some of those tools that we can use to help prevent pain and manage our pain better after illness or a procedure. So another thing just to keep in the back of your mind is most everybody at this point knows somebody affected by the epidemic, has an addiction themselves, or at least knows somebody who is dealing with this problem, because it is very prevalent in our community and in this nation, and we need to get a better grasp on it. So going back to pain management, the big thing with pain management is pain medication. That should be one of the last resorts. And we do prescribe pain medication because pain medication is needed in some aspects. And sometimes that is the one thing that helps us get a better handle on things and allows us to be comfortable during those most acute or early stages of either a post-operative period or an illness where somebody is in pain and they just need to get comfortable. But there are many other ways that we can help manage pain, and some of those things I'm going to discuss with you, and then I'll be curious to know if you've had any of these things written down. So a big one is using heat or ice. We never want a patient to use heat on a fresh surgical wound or an incision. Ice would be good in those instances. However, if this is just a painful condition where you have back pain or some stomach pain, heat or ice would be very helpful, and you can use whatever one works better. There's no right or wrong there. The rule of thumb there is 20 minutes on, 20 minutes off, and alternating like that. We also want to talk about aromatherapy. Scented candles or aroma diffusers or bath salts with fragrances that are appealing to you can help bring comfort. Creating a relaxing environment with soft, low lighting, dimming the lights, making sure things are quiet. Those are good ways to help relax and help decrease pain. Distraction is huge. Just getting your mind off of the pain by ways of word search puzzles, handheld games, TVs, movies, reading, those type of things are great tools to just get your mind off of it. Elevating the affected extremity. If you have surgery on an arm or a leg or a foot, just getting that extremity at least to heart level and allowing proper blood flow to get to that area would be can be helpful. A few other things I want to talk about are massage. If your healthcare provider feels it's okay, massage may be helpful in managing pain. Listening to music, moving to a different position, repositioning to find a more comfortable position. Walking or doing exercises is highly recommended, especially after some surgical procedures, to maintain comfort. Resting between activities, not allowing yourself to get too wiped out, or maybe causing an increase in pain if we're too active and we pay for it later. Practice spiritual healing, such as prayer or meditation, if that's something that works for you. Earplugs, warm blankets, using a familiar pillow or a blanket, are all, some great ideas to try to help manage pain. A couple other things I would like to talk about are holistic measures, such as seeing a chiropractor or using vitamin supplements. Some vitamin supplements can help stimulate our nervous system and help reduce pain. But those things I would have you talk to your doctor or your practitioner to see if they are in agreement with some of those other options, as I just mentioned. So those are really some great ideas to help manage pain. And again, I didn't mention pain medication, and pain medication is part of the list, but it's at the very bottom. So taking that medication only when it's needed and taking it as prescribed is very important, and decreasing the amount of medication you're taking as early as possible as your pain allows. So those are all things and all ways we can help manage pain appropriately. I do want to talk about my story and why I'm discussing managing pain during an opioid epidemic. I do have a family history of drug and alcohol abuse, and I have lost several family members, 4 immediate family members to be exact, from opioid addiction and abuse. So I feel very passionate about this, and I hope that something that I said in this video can be helpful for you and help you better manage pain in the event you need it. Thank you.